Question relates to mental health issues. You spoke about the obvious investment in children ages 0 to 25. I got an email yesterday from a mother who lost her 21-year-old son to heat exhaustion after he was released from a jail. She doesn't blame the jail for releasing him. She blames the system and lack of resources as a mother, as a parent of an adult child, and her inability to get him the help he desperately needed because he's 18, over 18, and she can't do anything to really force him to get the help he needed. What can the state do in terms of enacting laws or changing the laws when it comes to adult children with mental health issues?
Well, significant what we did this year in terms of unprecedented supports, $4.3 billion. I really do want to reinforce that because it is the most substantive answer that I can provide to that question. I can't make up for the last 20, 30 years, 40 or 50 years. His predecessor of mine by the name of Ronald Reagan, who in 1967 began the process of dismantling, infamously in his first state budget, the behavioral health system here in the state of California. The investments we're putting this year are unprecedented in U.S. history and in California history. And by the way, they include not just the $4.3 billion 0 to 25 for the screening and supports for adolescents up to the age of 25, but also unprecedented investment in housing, $3 billion, 2.8 to be exact, that we announced yesterday in Long Beach. I would guide you and direct you, and my staff's going to provide you a detailed response to the question. Perhaps we can provide it to the mother and express condolences, obviously, to the tragedy that she's enduring. But we laid out yesterday a behavioral health plan for the state, detailed. Issues of 5150s, issues around Laura's Law, issues around conservatorships, issues around Laura's Law placements, in addition to the $2.8 billion of housing to provide those placements. So we have done a lot, and we have done a lot more than not critics have suggested, even supporters are aware of, including making Laura's Law, which is very meaningful, an opt-out in counties as opposed to an opt-in, which has significantly ramped up its resource as a tool in the toolkit to help people get the kind of treatment they need, particularly those in acute crisis. So comprehensively, we're hitting this head on, but we have a lot of work to do to make up for decades of neglect in this space.